Okay, so today we'll talk about proteins. So this is the part one of our discussion regarding proteins. So we'll talk about the different amino acids and amino acidopathies for this video. Okay, so regarding amino acids are the building blocks of proteins. So if we're going to think of an analogy for this, uh, for example, there's a house, okay? And if this is a concrete house, in order to complete this concrete house, you need building blocks. And one of the building blocks of this concrete house will be hollow blocks. Okay, so hollow blocks, hollow blocks, hollow blocks, hollow blocks, hollow blocks. Okay, and you need steel bars. Okay, and so pailayan na basta ka ng for to make it what do you call this? Strong, mga kabilya, simento, those are the building blocks. So if that is the analogy, then hollow block, cemento, those are the amino acids. And the protein is the house. Okay? So regarding amino acids, what are the functions of amino acids? You have growth, repair, and maintenance of all cells. Okay? And regarding the characteristic or activity of proteins, it is dependent on the chemical properties of the amino acid. So the characteristic of a protein is dependent on its amino acid makeup or composition, or the properties of the amino acid present in that protein. Okay. Now, regarding types of amino acids, or regarding amino acids, about half of the amino acids cannot be synthesized by our body. So there are amino acids that can be synthesized by our body, and there are also amino acids which cannot be produced or synthesized by our body. So regarding amino acids, there are two types of amino acids. You have the essential amino acids and the non-essential amino acids. So what is the difference between essential and non-essential amino acids? So let's talk about first regarding essential amino acids. So example of essential amino acids, you have arginine, histidine, isoleucine, leucine, lysine, methionine, phenylalanine, threonine, tryptophan, and valine. So these are your essential amino acids. So what is an essential amino acid? It is a type of amino acid that you need to that you need because or that you need to eat or get it from your diet. Okay, why? Because you cannot form these type of amino acids. Your body is not capable of producing arginine, histidine, isoleucine, leucine, and other essential amino acids. You need to get it from your diet. Okay, that's why it is essential. You need to get it from your diet. Okay, so your body cannot produce these amino acids. Okay, that's for essential. Next, you have the non-essential amino acids. So alanine, asparginine, aspartic acid, cysteine, glutamine, glutamic acid, glycine, proline, serine, and tyrosine. So these are your non-essential amino acids. So you don't need to get it from your food or diet. It's because your body is capable of producing these amino acids. Okay, even though it's not present in your diet, your body is capable of producing these type of amino acids or these amino acids. That's for non-essential amino acids. So meaning, if it is essential, you need to get it from your diet. Your body cannot produce it. But for non-essential, that's why it's non-essential. You don't need to get it from your diet because your body is capable of producing non-essential amino acids like alanine and other non-essential amino acids. Okay, so that's the difference between non-essential and essential amino acid. Okay, next, the role of pepsin and gastrin. So regarding pepsin, pepsin is an enzyme. It's a stomach enzyme and it's needed in the digestion or breakdown of proteins to produce amino acids. Okay. Now regarding gastrin, gastrin is a hormone. Okay, produced by the G cells. Okay, G cells of your stomach, and it stimulates the stomach to produce uh, gastric acid or hydrochloric acid, which is important in the digestion of proteins. Okay, so after that breakdown of proteins to amino acids, next is it will be absorbed. Okay, and after absorption, the amino acids will now be present in your circulatory system or in your blood. Okay, so that is the flow. Okay, so first is you ingest food with proteins. The next is the digestion. After digestion, have the absorption. And after that, the amino acids will be present now in your blood or circulation. Now, what's the main purpose of amino acids? So it is important in the synthesis or formation of body proteins. So regarding body proteins, we have plasma proteins, intracellular proteins, and structural proteins. So example of plasma proteins, you have albumin and globulins. So under globulins, there are a lot of examples of globulins or types of globulins. You have the immunoglobulins, the alpha-1 antitrypsin. So we'll discuss the different globulins in the next or the part 2 of our discussion regarding proteins. So next is intracellular proteins. So example of intracellular proteins, you have hemoglobin. Okay, so hemoglobin is an example of intracellular protein. The next is structural proteins. So for structural proteins, example keratin. So keratin is present in hair, nails, and the next example of structural protein, you have elastin, which is present or the main component of connective tissue. So example, you have ligaments and tendons. Okay, so those are examples of proteins, structural proteins. So synthesis of purines, pyrimidines, porphyrines, creatine, histamine, thyroxine, epinephrine, and coenzyme NAD. So if you want to produce these substances, then you need amino acids. Okay. Then regarding amino acids, it provides 12 to 20% of total body energy requirement. Okay, because we have three main sources of energy. First is carbohydrates, that's the primary. Secondary, you have fats, and third, you have proteins. Okay. Now, there are glucogenic amino acids and there are also ketogenic amino acids. So for glucogenic, it generates precursor to glucose. So if you want to form glucose, then you need glucogenic amino acids. So these glucogenic amino acids will be converted to glucose through the process of deamination. Okay. Then for ketogenic amino acids, these amino acids give rise to ketone bodies. Okay. Now, the ammonium ions formed during deamination will be converted to urea. So if there's deamination of amino acid, then the product of that of deamination of one of the products of that deamination is ammonium ions or ammonia. So ammonia is toxic to the body. That's why our liver must convert it to urea for excretion. Okay? So if there's a problem with your liver, then ammonia will accumulate in your system and can cause damage to your brain and other organs. Okay, so first example of an essential amino acid, it's arginine. So arginine is important in cell division, healing wounds, and stimulation of protein synthesis. And it's also important for immune function and release of hormones. Okay, and it is important for the synthesis of creatine. Okay, so creatine is present in muscle, and if this will be used as source of energy, this creatine will be converted to creatinine. Okay, so creatinine is one of the kidney function test, diba? So Arginine is basically important in the formation of creatinine because without arginine, you cannot form or your body cannot form creatine, which is the precursor of creatinine. Next essential amino acid, you have histidine. So it's a precursor of histamine, and histamine is involved in immune response, particularly during allergic reaction. Okay, so histamine is usually released in great or big amounts if there is the presence of allergens. Okay, allergens. Okay, so if there's an allergen able to enter into your body, automatic your body will produce histamine, okay, histamine to expel or to get rid of this antigen. Okay, that's the function of your histamine. That's why if you have allergic reaction, diba, mag-sneeze ka sige because your body is trying to get rid of that allergen. Another is the effect of allergen plus histamine reaction have kind of itching imong skin. Okay, that's the effect of histamine. That's why people with allergies, they usually take antihistamine. Okay, antihistamine. The purpose of that one is to counter the effect of histamine. Because ang reaction between allergen and histamine, it is itchy, inana, dili siya comfortable. That's why people will take antihistamine, okay, to counter the effect of histamine. Okay? But that effect or that response or the production of histamine by your body is a normal reaction to the presence of allergen. Okay, it's an immune response. Okay, now regarding histidine, it is important in the synthesis of purines, and it also helps in the growth and repair of body tissues, and it maintains the integrity or the health of the myelin sheath. So a myelin sheath, that's the covering of your nerves. Okay, then it helps in manufacturing RBC and WBC, and it also helps protect the body from heavy metal toxicity, and it stimulates the secretion of digestive enzyme gastrin. Okay, so ang gastrin, one of the reason or one of the stimulus, okay, in the production of or stimuli in the production of gastrin, it's the amino acid histidine. And gastrin is also important in the digestion of proteins for your body to absorb amino acids. Okay. Next is isoleucine. So it helps in maintaining and heal and repair of muscle tissue, skin, and bones. And it is needed for hemoglobin formation. And it also helps regulate blood glucose level. That's for isoleucine. So next, essential amino acid, you have leucine. It's second most common amino acid found in protein besides glycine. And it boosts healing of muscle and skin and bones. And it aids in recovery from surgery. And it lowers blood glucose. And it is necessary for optimal growth of infants and for nitrogen balance in adults. So regarding nitrogen balance, it is the balance between or the rate, the difference in the rate of anabolism and catabolism. So the difference is anabolism is the formation of proteins. Okay. Catabolism, you have the breakdown. Okay. So for infants or for children, usually the rate of anabolism is greater than the rate of catabolism. Okay. Because during childhood, the body will try to synthesize more protein so that it will facilitate growth. But if the person or the patient is malnourished, then it will have the opposite. So the amount of anabolism, the rate of anabolism is uh, less than the rate of uh, catabolism. Okay, so the body will try to catabolize proteins and make it a source of energy. Okay, that's for malnourishment or malnourished individuals. There's increase in the rate of catabolism. Okay, so if there's increase in the rate of catabolism, it is also expected that urea will be elevated. So mas taas siya, or there's increase because of conversion of proteins to urea. Next, you have lysine. So for lysine, it plays a role in production of antibodies, and it lowers triglycerides, and it's needed for proper growth and bone development in children. Because for lysine, it helps in the absorption or conservation of calcium, and calcium is very important for bone development. Okay, and it also maintains proper nitrogen balance in adults, and it plays important role in collagen formation. So collagen is a component of cartilage and other connective tissues. So if there's a problem with your lysine level, if your food is not rich in lysine, then there will be a problem with your collagen level. And if there's a problem with your collagen, then the quality of your, or the kanang health of your cartilage and other connective tissue uh, is also affected. Okay, so that's for lysine. Okay, it is important in the formation of collagen. Okay, so regarding collagen, that's also the protein that's important in maintaining the health of your skin. Okay, so that dili kay musag imong skin. Okay, ang collagen na siya. Okay, and vitamin C is also uh, associated with the amount of collagen or the quality of your collagen. Okay, nalimot lang ko sa connection nilang duha, but mo na siya. If you have a lot of vitamin C, or if you take enough vitamin C per day, then you'll also have a good amount of collagen in your body, and mas dili musag yung skin if you're conscious about your imong face kanang musag siya, then you need to have a healthy level of collagen. Next essential amino acid, you have methionine. So it helps initiate translation of mRNA, and it is a source of sulfur that is required by the body for normal metabolism and growth. And it also assists in the breakdown of fats, and it helps detoxify lead and other heavy metals. And it also helps in diminishing muscle weakness and prevents brittle hair. And methionine reacts with ATP to contribute to the synthesis of the hormone epinephrine. Okay, so uh, I think epinephrine is an amine hormone. Okay, it's an amine hormone because you need methionine, an amino acid, to form epinephrine. Okay, so that's for epinephrine. So there are four amine hormones. You have epinephrine, norepinephrine, then T3 and T4. Okay. Next, non-essential amino acid, you have phenylalanine. So it promotes alertness and vitality. So it is used to treat arthritis and depression because phenylalanine decreases pain and it elevates mood, which is important for the management of depression. And it aids in memory and learning, and it is important in the production of norepinephrine, a hormone and a neurotransmitter. So norepinephrine is an amine hormone because you need phenylalanine, an amino acid, in the formation of norepinephrine. And phenylalanine is a part of the composition or a component of aspartame. So what is aspartame? Aspartame is a common sweetener, and it is used as a replacement for sugar. That is the sweetener present in food labeled with diet. Okay, diet Coke. If na kay diet Pepsi, okay, that is the sweetener present in your diet Coke. aspartame. Okay, so aspartame is a combination of phenylalanine and aspartic acid. Okay, so what's the use of aspartame? Replacement for sugar, because sugar is excessive amount of sugar, or sugar in excess is bad. Sugar alone, or sugar nga normal or healthy amount, or dili siya excess, sugar is healthy. But if in excess, dinha na ang unhealthy siya. So, ang pakulo din sa mga companies is to introduce Diet Coke. Okay? And ang Diet Coke, it's using aspartame as sweetener. Now, the problem with aspartame, that aspartame will be converted to methanol. And if there is high levels of methanol, that methanol will be converted to formaldehyde. And formaldehyde is carcinogenic. But there are no studies nga maka-prove or makahatag of what level or what is the particular or specific amount of formaldehyde that is carcinogenic to our body. Okay, so lacking pag-study regarding aspartame, regarding the amounts of formaldehyde being produced by the aspartame that can cause cancer to humans. But there are notions nga aspartame is associated with blood cancer or kana mga leukemia, may nana. Okay? So, ang aspartame, if you're consuming a lot of Diet Coke, that's not healthy. Okay? Bisan mo yung kag Diet Coke na siya. Okay? So, wala lang. Once you consume a lot of processed food or processed nga product, you're decreasing your lifespan. Okay? That's why ang generation karon mas shorter lifespan compared sa katong sa una. Okay? It's because of uh, processed food. Okay, so if you compare the lifespan of the boomers and kanang mga karon nga generation mas batanon, mas taas gitong mga boomers. Okay, it's because of healthier or healthy diet. Okay, they're not bombarded with processed food. Okay, and we should not blame the companies who are producing those processed food, because there are times that you need processed food. You should not kanang consume it regularly lang. Because if wala yung mga processed food, then it's difficult for us to have kanang ready to eat nga food nga makakatag nato convenience or makarry nato if natay lakaw. Imagine if wala yung mga processed food pod. That's why nagitay trade-off. Okay? There is no solution. There are only incremental trade-offs. Okay? Kaya kung wala po ng mga processed food, wala tayo convenience nga makuha. Okay? It's up to us kung unsa atong pilion. It's not the di na siya sala or ang nakakos ani atong problem karon regarding sa atong health kay kanang mga companies. No, kita mismo, because we don't know how to impose discipline. We don't know how to control ourselves. Easy lang nato pag blame nila nga sila nakakos ani atong mga health problems, but no, dili na. Kita ang nag-create sa atong health problems. Okay? Ano man, sige tang consume og fast kanang sa mga fast food chain, sige tang order din na, sige tang kao chichirya, sige tang inom og coke. Then hilas pa kay ta mo pray nga, Lord, give me good health. Then every single day you're destroying your health by drinking coke, consuming chichirya, drinking liquor. Oh, then hilas pa kay ta mo ingon og ingon ta dayon nga, Lord, give me good health. Pray patag inana. Same na siya with we want to achieve things. Okay? So, na din ta, Lord, help me to achieve great things or to achieve my goals. But you're always procrastinating. You're not doing your part. Okay? So if you want good health, then you need to choose the right pud nga mga actions. Okay? So dili lang na para nimo para po na ako kay because every single day sad ako tang gina-destroy akong health. Okay? So we should not blame those companies making those products because we have the option not to consume those products. Okay? Uh, problematic kay ng tao nga siyang think nga sige siyang ga-blame sa other people. Okay? Dili na mayo nga mindset. Start og clean imong self. Okay? Look sa imong self unsay problem nimo. Maybe you have problem with self-control. Okay? You cannot control nga maglantaw og coke. Ganahan ka mo inom coke because of the sensation diri sa imong throat. Okay? Or na ma-feel nimong sugar rush. Okay? So walay problem ang coke. Ang company, ikaw ang may problema. Okay? Why you're consuming Coke or drinking Coke, ang kabalo mo kang bad na siya. Okay? So, wala lang. Maybe ang problem nato or nadyo na sa atong self ang problema. Wala na siya sa outside. Okay? Wala lang. Check ka lang na siya. Next, essential amino acid, you have threonine. It's an alcohol-containing amino acid, and it's an important component of the formation of protein, collagen, elastin, and tooth enamel. And it is important in the production of neurotransmitters, and it aids in liver function, metabolism, and assimilation. Then next, you have tryptophan. So for tryptophan, it is a precursor of serotonin and melatonin. So melatonin is it's a sleep hormone, and serotonin it stabilizes our mood. Okay, it's tryptophan. It's a natural relaxant because this tryptophan is a precursor of serotonin and melatonin, which are hormones that serves as relaxant. Okay, and regarding tryptophan, it reduces appetite and it alleviates insomnia because tryptophan uh, is essential in the production of melatonin, and melatonin is a sleep hormone. Okay, and it helps control hyperactivity in children. Okay, kaya diba relaxant siya. Okay, so it helps control the control hyperactivity. Okay, so that is for tryptophan. Okay, so you cannot form serotonin and melatonin without the amino acid tryptophan. Then next, or the last essential amino acid, you have valine, and it's a constituent of fibrous protein, and it's needed for muscle metabolism and coordination. And it's also important for tissue repair and maintenance of nitrogen balance, and it's used by muscle tissue as source of energy. So those are the 10 essential amino acids. Meaning of essential amino acids, you need to have it from your diet because your body cannot produce these essential amino acids. Okay, so you need to get it from your diet. Next, you have the non-essential amino acids. So for non-essential amino acids, you don't need to get it from your diet because your body is capable of producing these non-essential amino acids. So example, you have alanine. So it's a product of the breakdown of DNA, and it facilitates the transfer of nitrogen from peripheral tissue to the liver, and it is involved in the production of antibodies. Next, you have asparginine. So it's principal and frequently the most abundant of the amino acid involved in the transport of nitrogen. And it converts amino acids into another via amination. And it is required by CNS and plays important role in the synthesis of ammonia. Okay, that's for asparginine. Next, glutamine. So it is the most abundant amino acid in the body, and 61% of skeletal muscle tissue is made up of glutamine. And glutamine is converted to glucose when more energy is needed. Okay, So it is a gluconeogenic type of amino acid, not ketogenic. And it assists in blood pH stabilization, and it transports ammonia to the liver. So that's for glutamine. Next, non-essential amino acid, you have glycine, and this is essential for the synthesis of nucleic acids, bile acids, proteins, peptides, purines, ATP, porphyrines, hemoglobin, glutathione, creatine, bile salts, glucose, and glycogen. And liver uses glycine to help in detoxification process. One of the functions of the liver is detoxification. Next is proline. It's a precursor of hydroxyproline, which is present in collagen, tendons, ligaments, and heart muscle. And it works with vitamin C to promote healthy connective tissue. Okay, so that's why vitamin C is also important for collagen formation. Okay, same with proline, it's also important for a healthy connective tissue. Then next is serine. It's needed for the proper metabolism of fats and fatty acids, and it plays important role in the body's synthetic pathways for pyrimidines, purines, creatine, and porphyrines. And it's a component of the protective myelin sheath, which covers the nerve, and it aids in the production of immunoglobulins. Next, you have tyrosine, another is non-essential amino acid. So it is synthesized from phenylalanine. This is from phenylalanine, and it's a precursor of epinephrine. So it's needed in the production of epinephrine, norepinephrine, dopamine, and thyroid hormones. That's why it's important, or it plays a role in the reduction of body fat, because thyroid hormone facilitates the breakdown of bad body fat or breakdown of fats, and it suppresses appetite. Okay, and it's good in mood elevation. It's a mood elevator. That's for tyrosine. Okay, so I think that's all for uh, non-essential amino acids. So there are non-essential amino acids that were not included, or that are not included in the discussion. Uh, But I've mentioned it sa mga previous ng slides sa itong mga non-essential amino acids. So, usually, wala na ako siya na-discuss because murag repetitive ra siya og mga functions with other amino acids. Okay? So, you have the amino acidopathies. So, what is amino acidopathy? So, it's a rare inherited disorder of amino acid metabolism. So, when you talk about amino acidopathies, it's all about problems with the metabolism of amino acid. And first, um, disease or example of amino acidopathy, you have phenylketonuria. So for phenylketonuria, it is an autosomal recessive disease. So it occurs in 1 in 10,000 births. Okay, so it's a rare disease. But if the baby or the person has phenylketonuria, then that person will have problems with the metabolism of the amino acid phenylalanine. Okay. So it's the absence of the activity of phenylalanine hydroxylase, or also known as phenylalanine 4 monooxygenase. So there's a deficiency in the enzyme phenylalanine hydroxylase. Okay. Now that phenylalanine hydroxylase enzyme is important in the conversion of phenylalanine to tyrosine. Now, in this disease, since there is less amount or decrease in the amount of phenylalanine hydroxylase, then there's a tendency for phenylalanine to accumulate. Okay, so there is phenylalanine accumulation. Okay, so that is for phenylketonuria. Now, since the body cannot convert phenylalanine to tyrosine, it will try to convert phenylalanine to phenylpyruvic acid. Okay? And after that, the next conversion is to convert phenylpyruvic acid to phenylactic acid. And the next conversion is the conversion of phenylactic acid to phenylacetylglutamine. Okay. Now, the distinct characteristic of the urine of a patient with phenylketonuria, the odor of the urine has a musty, okay, odor, okay. So musty odor urine, it's because of the buildup of phenylpyruvic acid, phenylactic acid, and phenylacetylglutamine. And there's also the presence of phenylalanine in urine. Okay, so what is the reason of phenylketonuria? It's the inability of the body to convert phenylalanine to tyrosine. Why or what is the cause? It's the deficiency in the enzyme phenylalanine hydroxylase. Okay, so a patient with phenylketonuria must avoid food with phenylalanine or any food nga na phenylalanine. That food should not be consumed by a patient with phenylketonuria to avoid buildup of phenylalanine, okay, and other substances uh, that are products of the conversion of phenylalanine. Okay, diba? The way or proper way is to convert phenylalanine to tyrosine. But the problem is there is no phenylalanine hydroxylase, not enough phenylalanine hydroxylase. That's why phenylalanine will be converted to phenylpyruvic acid, phenylactic acid, and phenylacetylglutamine. And there's also accumulation of phenylalanine. Okay, so that is for phenylketonuria. Okay, next is the effect, okay, of PKU to infants and to mothers or pregnant women. So first is the effect of PKU to infants is mental retardation. Okay, because of the toxic effect of okay, phenylpyruvate, okay, to the brain. Okay, there's accumulation of phenyl pyruvate. Okay, so usually mental retardation happens in second or third week of life. Okay, the reason for this one is the toxic effect of pyruvate. So how to prevent this mental retardation that occurs in patients with PKU? First is detection at birth, meaning to perform newborn screening. Okay, one of the tests under newborn screening, it is your phenylketonuria. Okay, so what is the reason of newborn screening? It is to detect diseases, okay, so that you'll avoid complications on that or to avoid complications of that disease. So for example, for PKU, why we are going to perform NBS or newborn screening is to detect PKU and to avoid the complications of PKU. Okay, that's the main purpose of newborn screening. Okay, so that ma-avoid the mental retardation. So without newborn screening, a patient with PKU, dili siya ma-recognize or dili siya ma-diagnose with PKU and late na siya ma-diagnose, like mentally retarded ng patient. Okay? So after mental retardation, that's the time nga ma-diagnose siya. So to avoid that one, that's why you have newborn screening. Okay? Detection at birth so that we can prevent complications. So how to prevent complications of PKU? Infant must follow a diet with low levels of phenylalanine. Okay, so this is PHE, phenylalanine. Okay, so first is detection at birth, and after detection, next is to give or follow a diet with low levels of phenylalanine because the infant is not capable of converting phenylalanine to tyrosine. So the diet should be less of or has low level of phenylalanine. So for this one, the doctor and the dietitian should work together in order to come up with a diet specific for a patient with PKU. Okay, so I think a high protein diet should not be followed by a person with PKU because phenylalanine is an amino acid. So usually it's present in high protein diet. So a patient with PKU should avoid high protein diet. Okay? So, munto siya. NBS or newborn screening, the purpose of that is to detect diseases, rare diseases like PKU, and to avoid the complications of that disease. Okay? So that's why nowadays, di ba in your medtech laws, I think na may newborn screening, na-discuss mo na newborn screening. Hindi ko sure ha, hindi ko na naka-sure. But requirement na siya so that ma-avoid natin ang complications sa mga bata. Okay? And that's why it's not allowed na mo give birth sa balay lang. Okay? So usually ang pag kanang delivery, the mother or the pregnant woman should be lying in clinic or in the hospital so that after the kana delivery, uh, the medical technologist can collect blood immediately for newborn screening. Okay? So that ma-identify ang problem sa bata. Okay? And the purpose of that is for prevention. Okay? So next, mother with PKU. What is the effect if the pregnant woman has PKU, uncontrolled PKU? So the baby will be microcephalic. And if the baby is microcephalic, then it is sure that that baby will have mental or has mental retardation or it is mentally retarded. Okay? So to avoid microcephaly or microcephalic baby, the mother should have controlled levels of or has a controlled PKU. Meaning, nag-follow siya sa iyahang management for PKU during pregnancy to avoid microcephaly. Okay? So that's for the management, okay, of PKU in infants and mother or pregnant women with PKU. Okay? Okay, so what are the laboratory tests in the diagnosis or determination of uh, phenylketonuria? So first, you have the reference method. It's high performance liquid chromatography. Then for other laboratory tests, you have GO3 bacterial inhibition assay. So for GO3 bacterial inhibition assay, you need a medium. Okay. And that medium contains thionyl, beta thionyl alanine. Okay, alanine. Beta thionyl alanine. So this is the antagonist. Okay, antagonist of the bacteria. Okay, so it's bacterial inhibition, so meaning we need to introduce bacteria. So the bacteria that we're going to use for GO3 bacterial inhibition test is your Bacillus subtilis. Okay, Bacillus subtilis. Okay. Now, if the so for the procedure, you need to add blood, okay, to the plating medium. And if the patient has no PKU, then no enough phenylpyruvic acid or phenylalanine that will react with beta thionylalanine. Okay? So this beta thionylalanine will be available in killing Bacillus subtilis. Okay? So the result will be no growth. Okay? No growth because the beta thionylalanine, okay, prevents the growth of beta, no, not beta, Bacillus subtilis. Okay? Because the beta thionylalanine was not used in reaction with the phenylalanine present in blood because the patient has no PKU. Now, what if the patient has PKU? So let's go back kanimong plating medium. So if this is the plating medium, then you have thianyl beta-alanine, okay? And you add blood, okay? And you have the Bacillus subtilis, okay? So what if the patient has PKU? So meaning there's increase in phenylalanine and phenylpyruvic acid. Those phenylalanine and phenylpyruvic acid will react with the beta-thianylalanine. Okay? So, the beta-thianylalanine will not be effective in the inhibition of the growth of Bacillus subtilis because it was used na in the reaction for, or it already reacted with uh, the phenylalanine present in the sample. So there's no available beta-thianylalanine that will inhibit the growth of Bacillus subtilis. So wala na may available nga beta-thianylalanine. So Bacillus subtilis will grow. So if there's growth, then the result is positive, meaning the patient has PKU. Okay? So I'll repeat. So for GU3 bacterial inhibition test, if the patient has no PKU, so for example, for this one, no PKU, so meaning no phenylalanine that will react with beta-thianylalanine. So this beta-thianylalanine will be available in the inhibition of the growth of Bacillus subtilis. So the result will be no growth. But the patient has no PKU. Okay? Negative for PKU. Now, what if the patient has PKU, meaning there is increased concentration of phenylalanine because the patient cannot, or the body of the patient cannot convert phenylalanine to tyrosine. So there's a buildup of phenylalanine in his or her blood. So that phenylalanine will react with beta-thianylalanine. So there's no available beta-thianylalanine that will react with Bacillus subtilis. Thus, it will result to growth of Bacillus subtilis. So nag-grow ang Bacillus subtilis because the beta-thianylalanine antagonist was used in the reaction with phenylalanine. So meaning there's increase in phenylalanine. So the patient has PKU. Okay? So if na growth, that is positive result. Okay? Without growth, that's negative. Okay? Next is you have microfluorimetric assay. So this is a fluorescence type of assay. So it's more of a quantitative because GO3 is more of a semi-quantitative or quantitative. Okay? It's either positive or negative lang. So it's uh, not semi-quantitative. It's GO3 is qualitative, not quantitative. Okay? But for microfluorimetric assay, it's quantitative because you can measure the amount of uh, phenylalanine using this method. Okay? So for microfluorimetric assay, you're going to add or use trichloroacetic acid. So trichloroacetic acid, and you react that with, or you mix that with the blood or the disc, okay, that contains the specimen. Okay, ang disc kay mo siyang filter paper ha, because for newborn screening we usually collect blood from the heel and mag-use ta og lancet, and ang atong butang sa sample is the filter paper. Okay, so the disc that contains the blood specimen or specimen then reacted with TCA or trichloroacetic acid will produce fluorescence. So the amount of fluorescence is directly proportional to the concentration of phenylalanine. Okay, so it is quantitative, but for GU3 it is qualitative. It's either positive or negative. Okay. Next is you can also perform urine testing for phenylpyruvic acid. So This can be used for diagnosis and monitoring of dietary therapy if the dietary therapy is effective. So you're going to use strip that contains ferric chloride. Okay. And if the sample of the patient has high levels of phenylpyruvic acid or has phenylpyruvic acid, then that phenylpyruvic acid will react with ferric chloride to produce green color. Okay, that's for urine testing. So in the previous slide, it uses blood, okay, as sample. For this one, it uses urine. Okay. Now, another is through prenatal diagnosis. So for prenatal diagnosis, you have DNA analysis. So it's more of identifying the chance of the baby uh, to have um, PKU by analyzing the DNA of the mother. If the mother has kana gene that codes for PKU. Okay, it's more of preventive or alam mo siya para ng for breast cancer, diba, there's a gene called BRCA gene, BRCA1 gene, and that gene codes for breast cancer. Okay, so if you have that gene, meaning you have higher chance of having breast cancer. Same for this one. If the purpose of this one is to check if there is a gene that codes for PKU. Okay, so muna siya prenatal diagnosis. Next is tyrosinemia. So this is the second amino acidopathy. So for this amino acidopathy, it is a metabolic disorder of tyrosine catabolism. So for phenylketonuria, the problem is in the catabolism of phenylalanine. So for tyrosinemia, the excretion of tyrosine and tyrosine catabolites in urine. So it is expected that there are tyrosine and tyrosine catabolites in urine because of the failure of the body to convert or to digest or to catabolize tyrosine. That's for tyrosinemia. And there are three main types of tyrosinemia. So first is type 1 tyrosinemia. It is the most severe, okay, because there's a deficiency in fumarate acetoacetate hydrolase, okay? Because if there is the deficiency in this enzyme, fumarate acetoacetate will accumulate and there's a tendency to convert this one to succinyl acetone. And succinyl acetone is toxic. Okay? So this enzyme, fumarate acetoacetate hydrolase, is important so that fumarate acetoacetate will be catabolized. Okay? To avoid the formation of succinyl acetone. So that's why it's the most severe because if there's a deficiency in this hormone enzyme, then succinyl acetone, there will be a buildup of succinyl acetone. So that's why it's the most severe form of tyrosinemia. And it occurs in 1 in 100,000 births. Okay. So for type 1 tyrosinemia, the deficient enzyme is fumarate acetoacetate hydrolase. This is the fifth and the last enzyme in the degradation that is needed in the catabolism of tyrosine or breakdown of tyrosine. Okay. So what are the symptoms of type 1 tyrosinemia? So first is failure to thrive, diarrhea, vomiting, jaundice, cabbage-like odor, distended abdomen, swelling of the legs, and increased predisposition for bleeding. So the reason for this one or these symptoms is because of the liver and kidney failure due to accumulation of succinyl acetone. Okay, that succinyl acetone can also cause problems with the central nervous system. Okay, so di ba kung swelling, if there's a problem with your both in your liver and kidney, then there's also problem with bleeding if or kanang clotting if you have problems in your liver. Okay, so that's for type 1 tyrosinemia. So there's a buildup of succinyl acetone. It's because of the absence or deficiency in fumarate acetoacetate hydrolase. Okay, that's for tyrosinemia. So next, type 2 tyrosinemia. So the deficient enzyme in type 2 tyrosinemia is tyrosine aminotransferase. So this is the first enzyme in the breakdown of tyrosine, and it occurs in 1 in 2,000 to 50,000 birds. Okay. And what are the conditions associated with tyrosinemia? Mentally retarded ang patient, has photophobia and eye pain and redness, and there are painful skin lesions on the palms and soles of the feet. Okay, so that's for type 2 tyrosinemia. Then for type 3 tyrosinemia, there's a deficiency in 4-hydroxyphenylpyruvate dioxygenase, and there's mild mental retardation. Okay, and seizures, and there's also periodic loss of balance and coordination. So important thing or note, there's increased succinyl acetone in tyrosinemia, especially in type 1 tyrosinemia. It's because of the deficiency in fumarate acetoacetate hydrolase. Okay, so what is the treatment or management for tyrosinemia? So same with your phenylketonuria, you have low protein diet because tyrosine is an amino acid and amino acid is the building blocks of proteins. Okay? Or to administer nitisinone. So nitisinone prevents the formation of fumarate acetoacetate. Okay? The function of fumarate acetoacetate hydrolase is to convert fumarate acetoacetate. Okay? So if there's no fumarate acetoacetate, then there is no problem with uh, the buildup of succinyl acetone. Okay, wala man siya substrate. Okay, because succinyl acetone is just a product of your fumarate acetoacetate. So the function of nitisinone is to avoid or to prevent the formation of fumarate acetoacetate. Okay, so that's the treatment or management for patients with tyrosinemia. Okay, so next is alkaptonuria. So for alkaptonuria, there's a deficiency in homogentisate oxidase. This is the enzyme needed in the breakdown of homogentisic acid. So for alkaptonuria, there's a buildup of homogentisic acid, and it is associated with ochronosis. So what is ochronosis? It is the bluish black discoloration of tissue due to the accumulation of homogentisic acid. So for example, there's a buildup of homogentisic acid in the sclera and the cartilage. So mo black ang tissue nga na accumulation of homogentisic acid. That's for ochronosis. And there's also a possibility of this homogentisic acid to accumulate in joints, causing arthritis. Okay? And characteristic of the urine from this patient, urine turns brownish black when exposed to air. So the urine of the patient with alkaptonuria, kay mo black siya once ma-expose ang urine sa air. Dili siya like during the collection kay unsa tawag ani unsa ni pag-collect pa lang daan kay black na urine. No. Once ma-expose sa air, then that's the time mo brownish black ang color. Okay? So occurrence or it occurs in 1 in 250,000 birds. Okay? And treatment is high dose of vitamin C because vitamin C prevents buildup of homogentisic acid. So for diagnosis, you can perform or you can use urine as sample and add ferric chloride to urine. And if it turns black, color of the urine turns black, then the sample is positive for high levels of homogentisic acid. And that is for alkaptonuria. Next amino acidopathy, you have the maple syrup urine disease. So for maple syrup urine disease, there is a deficiency in ketoacid decarboxylase, and this enzyme is important in the metabolism of leucine, isoleucine, and valine. So if there's a problem with this one, there's a deficiency in ketoacid decarboxylase, it is expected that there will be a buildup of leucine, isoleucine, and valine in the blood, and also it will be excreted in the urine. That's why the urine of a patient with MSUD, okay, has a maple syrup or burnt sugar odor, okay, sa urine, breath, and skin. Okay, it's because of the buildup of leucine, isoleucine, and valine. So for maple syrup urine disease, it occurs in 1 in 150K births. Okay, that's the occurrence rate of maple syrup urine disease. And the cause is the deficiency in ketoacid decarboxylase. Okay, so infants with MSUD will experience lethargy, vomiting, lack of appetite, signs of failure to thrive. They will not grow. And there's muscle rigidity and stupor. So what is stupor? It's a state near unconsciousness. And there's also respiratory irregularities. So for MSUD, those symptoms will progress to severe mental retardation, okay, seizures, acidosis, and even death if it is not treated or not managed properly. Okay, so for what do you call this? MSUD, the laboratory test is the same with phenylketonuria. It is to perform modified GO3 or GO3 test. So it's a modified GO3 test because you're using 4-aza-leucine as the antagonist instead of beta-phenylalanine. So same principle. For this one, the antagonist is aza-leucine and the sample contains leucine because there is a buildup of leucine because of the absence of the enzyme uh, ketoacid decarboxylase. Okay, so this leucine, which is present in urine or blood, or primarily urine sample, no, blood sample, okay, if there's high level of leucine, this high level of leucine will react with 4-aza-leucine, thus inhibiting the effect of aza-leucine, and this 4-aza-leucine will not be able to inhibit the growth of Bacillus subtilis. So thus, it will result to no growth. Okay? No, with growth. Okay? Balikon, kaya marag nagkasipyat. So if there is high level of leucine in blood, this high level of leucine in blood will inhibit or stop the action of 4-aza-leucine. Now, 4-aza-leucine is the antagonist of Bacillus subtilis. So since it is already used in the reaction with leucine, no 4-aza-leucine will inhibit the growth of Bacillus subtilis. That's why the result will be with growth. That's for positive for MSUD. But if the patient is negative for MSUD, meaning low levels of leucine, so there are a lot of 4-aza-leucine that will react with Bacillus subtilis, and it will result to no growth because 4-aza-leucine is the antagonist of Bacillus subtilis. So meaning no growth is associated with decreased levels of leucine. So meaning the patient has no MSUD. Okay? So same siya principle with your GO3 test or GO3 test for phenylketonuria. And another, same po ni siya, microfluorometric assay, you'll use leucine dehydrogenase as sample. So the reaction between the sample that contains leucine and leucine dehydrogenase, the result will be fluorescence. So that fluorescence, the degree or the amount of fluorescence is directly proportional to the concentration of leucine. If the concentration of leucine is greater than 4 mg per dl, then the patient is positive for MSUD. Okay, so that is for microfluorometric. So GO3 test is more of a qualitative, but microfluorometric is a quantitative assay for MSUD. So next amino acidopathy, you have isovaleric acidemia. So there is a buildup of isovaleric acid because of the deficiency in isovalerial CoA dehydrogenase. So for this isovaleric acidemia, it's more of a problem with the breakdown of leucine. Okay, and in that problem, there's a buildup of isovaleric acid. Okay, so it usually occurs in 1 in 250K births, and there's a distinctive or distinct odor of the urine. Okay, the urine has an odor of sweaty feet. Okay, so the reason why it's sweaty feet ang odor sa urine is because of the buildup of isovaleric acid. So symptoms, you have failure to thrive, vomiting, lethargy, coma, and eventually death if it is not managed properly. So treatment, same with other amino acidopathies, you have low protein diet and the administration of glycine and carnitine because glycine and carnitine will react with isovaleric acid in order to avoid the formation of um, toxic substances. Okay, so that is for isovaleric acidemia. So during sa board examination and during mo sa board exam, you're going to find ways or desperate ka to memorize each important points. And this one is one of the important points in or during board examination. This one, sweaty feet, and that is associated with isovaleric acidemia. So, ay mong hinumduman is sweaty, Valerie. Okay, ako alam pa naman si Valerie baho siya tiil. Okay, but dili bahog tiil si Valerie gida. Ako lang is para may numduman ako once if it is isovaleric, then it is associated with sweaty feet. Okay, kung sweaty mo gud ang feet usually baho ang tiil ana. Okay? So, wala lang. But dili baho ang tiil sa isa ka patient with isovaleric acidemia. Ang sweaty feet is the urine. Okay, sweaty feet mo na siyang odor sa urine for isovaleric acidemia. Then last amino acidopathy, you have homocystinuria. So for homocystinuria, there's a deficiency in cystathionine B synthetase, and it usually occurs in 1 in 200K births, and it's associated with osteoporosis. Okay, so there is an elevated level of homocysteine and methionine in blood and urine for this one. But there's a decrease, okay, uh, production of cysteine, okay, because of the failure of the body to metabolize homocysteine and methionine. So it's also observed that there will be dislocated lenses in the eyes resulting from the lack of cysteine synthesis that is essential for collagen formation. Okay, so remember for homocystinuria there is accumulation of homocysteine and methionine in blood. Okay, so that accumulation is because of the decrease in or deficiency in cystathionine B synthetase. And the effect, there will be decreased cysteine production. And if there's a problem with cysteine production, the collagen formation is also affected. Okay. Next, it's also associated with mental retardation. And for the test to detect homocystinuria, you have modified Guthrie test. But for this one, the antagonist or the inhibitor is L-methionine sulfoxamine. Instead of, di ba, for phenylketonuria, you're using beta-thioenolalanine. Okay? And for MSUD, you're going to use for Isoleucine. For homocystinuria, it is L-methionine sulfoxamine. This is the antagonist. Okay? Same principle, no growth meaning negative, positive growth, no. With growth, that is positive, no growth, negative. And if the patient has homocystinuria, he has increased cardiovascular risk or higher chance of having coronary heart disease. So I think that's all regarding amino acidopathies and amino acids. So next video, we'll talk about the different plasma proteins, and we'll discuss albumin, prealbumin, and globulins. Okay, so thank you and God bless.